Hello and welcome to another episode of Discover with Spinetti. Today's episode number 143. Today we're talking about why your implants fail, and we have a special guest. We have Charlie on, and Charlie's going to demonstrate how dental implants can fail. And today we're going to discuss the number one reason why dental implants fail. But before I go on, what is a dental implant? This right here, as you can see in the camera, let me get it focused. This right here is a dental implant. As you can see, it is almost the exact same size as the root of the tooth. Okay, you can see it right here. Okay, so if you're getting a dental implant, obviously you won't be able to see the metal part, but that is what a dental implant is. And once a dental implant is inserted, it actually becomes fused. So do you see here how Charlie has different bones, right? There's this type of bone, this type of bone. I'm not going to go into the anatomy of bones, but if you want to know, you can Google it. But all of these are separate parts of your skull. And that's why they're painted differently. Obviously, in your skull, it's not painted. But in Charlie's skull, because Charlie is a colorful character, in Charlie's skull, it is very much. Oh, look, it looks like I'm talking. Anyways, so yeah, so why am I saying this? I'm saying this because these bones right here, this bone and this bone, for instance, they are fused together, right? They're literally fused. They're like you cannot separate them. This bone and this bone. Oh, let me get it in focus. Let me get it in focus. There you go. This bone and this bone fused. This bone and these bones fused. Okay, same thing here. So what does fuse mean? Fuse means it's literally like when when two metals are welded together and you have them fused and they're inseparable. That's what happens with the implant. The implant becomes basically fused with your bone. Okay, so it becomes rock solid inside your bone. Okay, that's a very important fact because if your implant becomes fused with your bone, then the question is, as Charlie would want to ask, how do implants fail? Well, implants fail through very different ways, but the number one reason why it fails, now given that the implant's actually inserted properly, so given all that, given everything was done properly, the number one reason that dental implants fail is due to implantitis. Okay, so implantitis means infection around the implant. How do you get infection around the implant? I'm glad you asked. If you have an implant inside your bone, but you're smoking, what smoking does is that it restricts the amount of cells that go to the special areas that are needed for it. Okay, so it decreases your immunity in that region. So you can increase your infection that way because nicotine is a vasoconstrictor. Smoking is a big factor as to why implants fail. Diabetes or any kind of other autoimmune disease will decrease your or increase your infection rate because your immune system is not as strong. Oral hygiene habits, if you're not flossing. So if Charlie here is not flossing properly and he's not brushing properly, then obviously now the plaque is getting stuck in between the implant and the bone. And so now you're going to get more infection. If you don't go and get the area around the implant cleaned regularly every 6 months, and that's a must, okay? You're going to increase your plaque around that. And then guess what? You're going to get infection. So that is number one reason as to why implants fail. Okay, Charlie's head just came off. He's like, his mind just got blown from all this information. Isn't that right, Charlie? See, he's agreeing. Now, implants. Implants are basically there are two different components to the implant. That's it, just two. Okay, so when we put an implant in here, let me just show you again for illustration. That implant part, the metallic part, goes inside the bone. Okay, that yellow part there, that's an abutment, so that wouldn't be in your jaw. Okay, there are two components. The component here is that the metal component, and then you have the top component, which is the crown that goes on top of the metal, and that's it. Literally, that's it. It's two components. One component is the metal, and the other one is the crown. Some people are afraid of dental implants because they don't understand what's involved. And I'm telling you right now, that's it. It's not more complicated than that. So it goes in and we put a crown on and that's it. It looks and feels exactly like, and I just lost the implant. It looks and feels exactly like a tooth, like a crown tooth. So if you have any questions regarding dental implants or why dental implants fail or whether dental implants are right for you, because they're not right for everybody, obviously you have to have certain criteria that meet it, then feel free to give us a call or send us an email. We're more than happy to answer any of those questions for you. Happy Friday. And as always, keep smiling.